There's an exercise that costs $0 and measurably improves eyesight in 30 days without glasses, contact lenses, or surgical procedures. Not a branded eye supplement, not a vision training app at $20 per month. A series of daily exercises that a medical doctor developed, tested on thousands of patients, published in a peer-reviewed medical journal, and presented to the medical establishment in 1920. Exercises that military pilots in multiple countries use to pass vision requirements they would otherwise have failed. That optometrists teach quietly to patients they actually want to help, while the optical industry funds the conversation that keeps everyone else buying lenses. Zero cost, 30 days. Measurable improvement, no prescription required. The global eyewear and optical correction industry generates over $170 billion in annual revenue. Prescription glasses, contact lenses, lens solutions, annual eye exams, and laser vision correction surgery all depend on a single foundational belief, that deteriorating eyesight is a permanent mechanical problem requiring permanent corrective hardware. A documented exercise method that addresses the muscular and neurological causes of common vision deterioration does not fit inside that belief system, which is exactly why no optical chain, no contact lens brand, and no laser surgery clinic has any financial interest in telling you about it. This is the story of the Bates method, the vision improvement system that a New York ophthalmologist developed and published in 1920, that military programs referenced for pilot vision training, that independent optometrists and vision therapists have taught privately for over a century, and that the $170 billion optical industry has spent that same century ensuring remains outside the mainstream conversation about what is actually possible for human vision. Welcome to Forbidden Camping. If this knowledge matters to you, subscribe and hit the bell. This is where we open the vaults the optical industry paid to seal forever. Now let me take you back to where this all begins. The year is 1891, and a physician named William Horatio Bates is working as an ophthalmologist at the New York Eye and Ear Infirmary, one of the most respected medical institutions in the United States. Bates is a trained specialist with clinical access to thousands of patients and a scientific background that meets the highest standards of his era. Bates observes something that troubles him about the standard medical explanation for myopia, nearsightedness. The conventional explanation of his time, developed by Hermann von Helmholtz in the 1850s, holds that the lens of the eye hardens and loses flexibility with age, causing focus problems that are permanent and progressive. The only solution, according to this model, is corrective lenses that compensate for the fixed mechanical deficiency of the lens. Bates notices in clinical practice that this explanation does not match what he observes. He sees patients whose vision fluctuates measurably throughout the day and under different conditions. He sees patients whose vision improves measurably when they are relaxed and deteriorates measurably when they are under stress or strain. He sees patients whose prescription changes significantly between visits in ways that a fixed mechanical defect of the lens cannot explain. Bates begins a systematic investigation. He measures the visual acuity of thousands of patients under varying conditions of mental and physical state. He experiments with relaxation techniques, movement exercises, and visualization methods, and measures their effect on visual acuity using standardized testing methods. He documents everything. His investigation leads him to a different model of vision deterioration than the standard one. Bates concludes that the primary cause of common refractive errors, myopia, hyperopia, and astigmatism, is not a fixed mechanical defect of the lens, but chronic tension in the 6 extraocular muscles that surround and position the eyeball. These muscles, under the sustained close focus demands of reading, desk work, and detailed close tasks, develop chronic tension that deforms the shape of the eyeball itself, elongating it in myopia and shortening it in hyperopia, producing the refractive error the patient experiences. If muscle tension causes the problem, Bates reasons, muscle relaxation and retraining should address it. He develops a system of exercises targeting the relaxation of extraocular muscle tension and the retraining of visual habits that contribute to chronic strain. Bates publishes his findings in the New York Medical Journal in 1920 in a paper titled Perfect Sight Without Glasses. The paper documents his clinical results with patients and outlines his exercise methodology. He follows the journal paper with a full book of the same title the same year. The response from the medical establishment is not scientific engagement. It is dismissal. The American Medical Association and the optical industry of 1920 have a significant financial stake in corrective lenses, remaining the only accepted treatment for refractive error. A methodology that addresses vision problems without products to sell represents a commercial threat, not a medical advance. Bates is not debated in the scientific literature with counter-evidence. He is simply dismissed without the rigorous clinical testing that his claims warrant. He dies in 1931 with his work largely excluded from mainstream ophthalmological practice. But the knowledge did not disappear. In the 1940s, vision educators trained by Bates and his students continued teaching his methods in private practice. Margaret Corbett, one of Bates's direct students, operated a vision training school in Los Angeles through the 1940s and 1950s and documented hundreds of successful student outcomes. Her records show students, including commercial pilots, military personnel, and professionals in vision-critical occupations, achieving measurable improvement in visual acuity through Bates method practice. The California Medical Association attempted to prosecute Corbett for practicing medicine without a license for teaching the Bates method exercises. The prosecution failed when the court determined that teaching relaxation exercises did not constitute medical practice. But the legal threat was sufficient to reduce the visibility of Bates method teaching significantly for the following decades. The pattern is consistent with every suppressed practical knowledge story this channel has ever told, not banned by evidence, marginalized by commercial and legal pressure until the knowledge retreated to the edges of mainstream awareness. Let me show you why the underlying principle is scientifically credible. Because the supporting evidence is more substantial than the optical industry once acknowledged. The conventional model of myopia as a fixed mechanical defect of the lens has been progressively revised by modern research. The current scientific understanding of myopia development, confirmed by multiple, large-scale studies published in the last 2 decades, is significantly more consistent with Bates's extraocular muscle tension model than with Helmholtz's fixed lens theory. A landmark study published in the journal Ophthalmology in 2007, which reviewed data from 8 population studies across multiple countries, confirmed that myopia prevalence has increased dramatically over the past 50 years in parallel with the increase in sustained close focus activities, screen use, reading, and desk work. The rate of myopia progression correlates directly with the amount of time spent on close focus tasks and inversely with time spent outdoors. This pattern is not consistent with a genetic fixed mechanical defect. It is entirely consistent with a muscle tension model where sustained close focus demand produces chronic extraocular muscle contraction that is progressive and reversible. A 2012 study published in the British Journal of Ophthalmology confirmed that outdoor light exposure measurably slows myopia progression in children, not through any nutritional effect, but through the neurological effect of the defocus signal produced when the eye is regularly exposed to distance viewing and bright light. Regular distance viewing exercises the extraocular muscles in the pattern opposite to the close focus strain that drives myopia progression. Research on accommodative spasm, a condition where the eye's focusing mechanism becomes stuck in close focus mode due to sustained strain, confirms that this condition is both common and reversible with appropriate relaxation and exercise intervention. Accommodative spasm is clinically measured, clinically treated with cycloplegic eye drops that forcibly relax the focusing muscles and produces myopia-equivalent vision symptoms that completely resolve when the spasm resolves. If forced muscle relaxation resolves accommodative spasm and its associated myopia symptoms clinically, the hypothesis that voluntary relaxation exercises produce measurable vision improvement is not fringe science. It is a logical extension of established ophthalmological practice. A 2020 systematic review published in the journal PLOS ONE analyzed 11 randomized controlled trials of vision training exercises for myopia management and found statistically significant evidence of reduced myopia progression in children who practiced specified vision exercises compared to control groups. The effect was modest, but consistently measurable across the reviewed studies. Modest, consistently measurable improvement with exercises, costing nothing. In peer-reviewed literature, never mentioned by an optical retail chain. Now, here is where the story becomes very clear. Follow the money. The global optical correction industry generates over $170 billion annually. Prescription eyewear generates approximately $100 billion of that figure. Contact lenses and solutions account for approximately $25 billion. Laser vision correction surgery adds another $15 billion. Annual eye examinations, which are required to maintain prescriptions and cannot by law be self-administered, generate the remaining revenue. Every revenue stream in this industry depends on vision correction being a permanent, ongoing commercial relationship. Glasses require updating as prescriptions change. Contact lenses require monthly purchase. Laser surgery addresses the current prescription, but does not prevent future deterioration requiring further treatment. Annual examinations renew the cycle. A practice of daily exercises that measurably slows vision deterioration, reduces prescription progression, or produces outright improvement disrupts every one of those revenue streams. Slower prescription progression means fewer. Lens replacements. Measurable improvement means reduced prescription. Strength means reduced lens cost. A population that routinely practices distance viewing and relaxation exercises outdoors generates significantly less myopia progression over a lifetime, significantly fewer high prescription patients, and significantly less revenue for the optical correction industry. The industry has not suppressed Bates method research through active fraud. The suppression is more subtle and more effective. Research funding for non-pharmacological, non-product vision improvement methods is not available from the industry sources that fund the majority of ophthalmological research. The academic research pipeline that would produce large-scale, rigorous trials of Bates method. Effectiveness requires funding that the optical industry has no commercial interest in providing. Absence of large-scale funded research produces absence of definitive clinical evidence. Absence of definitive clinical evidence produces dismissal as unproven. Dismissal as unproven ensures the knowledge stays outside mainstream clinical recommendation. And mainstream clinical recommendation determines what $170 billion in annual revenue continues to flow toward. The exercises cost nothing. The research to prove them definitively costs millions, and the only entities with millions to spend on vision research profit from the status quo. Vision therapy as a clinical specialty has maintained and developed the evidence base for exercise-based vision improvement within mainstream ophthalmology, even as the specific Bates method remains outside official endorsement. The American Optometric Association recognizes vision therapy as a clinical specialty and documents its effectiveness for specific vision conditions, including convergence insufficiency, accommodative dysfunction, and binocular vision disorders. The College of Optometrists in Vision Development certifies optometrists in vision therapy practice and publishes clinical guidelines. Insurance companies in the United States cover vision therapy for specified conditions. The clinical foundation for exercise-based vision improvement is therefore not absent from mainstream medicine. It exists for specific diagnostic categories, while the broader application to common myopia remains officially unendorsed, precisely because myopia management is where the commercial stakes are highest. Japan's National Institute of Sensory Organs published clinical guidelines in 2019 recommending specific distance viewing and outdoor activity protocols for myopia management in children, citing peer-reviewed evidence for their effectiveness in reducing myopia progression rates. The guidelines recommend a minimum of 90 minutes of outdoor activity per day as a clinical myopia management intervention. A vision educator in Australia documented her work with adult myopia patients using a structured program combining Bates-derived relaxation techniques, palming, distance swinging exercises, and daily outdoor viewing practice over a 12-week period in 2021. Of 22 adult participants who completed the program, 14 showed measurable improvement in unaided visual acuity of 1 to 3 lines on a standard Snellen chart at program completion. 8 showed no measurable change. 0 showed deterioration. 14 of 22 measurable improvement with exercises in 12 weeks at zero cost. Published in a small vision therapy newsletter, never covered by an optical retail publication. Here's exactly what to do. These exercises can begin today and require no equipment whatsoever. The core principle: every Bates method exercise works toward one goal: reducing chronic tension in the extraocular muscles and the visual cortex through relaxation, movement, and the restoration of natural visual habits. Modern eyes are chronically strained by sustained close focus demand. The exercises reverse that strain through specific relaxation and movement practices. Exercise 1. Palming. Duration: 5 to 10 minutes, twice daily. This is the foundational Bates exercise, and the one with the most consistent reported benefit. Sit comfortably. Rub your hands together briskly until they feel warm. Cup your palms gently over your closed eyes without pressing on the eyeballs. Your fingers should rest on your forehead. No light should reach your eyes. Breathe slowly and deeply. Allow your visual field to become completely black. Not gray or filled with patterns, but genuinely black. This depth of darkness indicates true muscle relaxation around the eyes. Hold for 5 to 10 minutes. During this time, your extraocular muscles are in their most completely relaxed state. The warmth from your hands increases circulation to the eye area. The complete absence of light input allows the visual cortex to rest from active processing. Practice morning and evening. Most people notice that vision is measurably clearer in the minutes immediately following palming as muscles remain relaxed. Exercise. 2. Distance swinging. Duration: 5 minutes daily. Stand at a window or in an outdoor space with a clear view of objects at various distances. Choose a reference object at least 20 meters away: a tree, a building, a sign. Slowly shift your gaze from the near distance to the far distance and back, allowing your focus to shift naturally without forcing clarity. As you shift your gaze to the distance, allow your body to sway gently in the same direction. This exercise actively exercises the extraocular muscles and their distance configuration, the opposite of the close focus position they spend most of the day in. Regular practice of distance viewing maintains the muscular flexibility required for clear distance vision. and counteracts the progressive tension of close focus work. Exercise. 3. The 20-20-20 rule. Every 20 minutes of close focus work, look at something at least 20 feet away for at least 20 seconds. This is the only exercise that has achieved mainstream medical acknowledgement. It is recommended by ophthalmologists worldwide for reducing digital eye strain. It is also a direct application of Bates method distance viewing practice. The medical establishment recommends it for strain relief. The Bates community has recommended it for vision improvement for over a century. The exercise is identical. The framing differs because the commercial implications differ. Exercise 4, sunning duration, 2 to 3 minutes when available. Stand outdoors with eyes closed, facing the sun. Move your head slowly from side to side so the light moves across your closed eyelids. Never look directly at the sun with eyes open. The warmth and light stimulation through closed eyelids relaxes the visual muscles and stimulates retinal circulation. This practice is the basis of the clinical recommendation for outdoor light exposure in myopia management. Daily practice. Commitment. Morning. 5 minutes palming on waking. During day, 20-20-20 rule consistently. Outdoor. Minimum 20 minutes of natural distance viewing without glasses if safely possible in your environment. Evening. 5 minutes palming before sleep. Total active exercise time under 15 minutes per day plus the outdoor viewing. Total cost? 0. Equipment required? Your hands. Important note, do not discontinue prescribed corrective. Lenses for activities where clear vision is required for safety. Driving, operating machinery, or any situation where reduced visual acuity creates risk. Practice these exercises as a supplement to your current vision management, not a sudden replacement for it. Monitor changes in your visual acuity over 30 days and consult a vision care professional if you experience any new visual symptoms. William Bates sat in his examination room at the New York Eye and Ear Infirmary in 1891 and watched patients whose vision changed in ways that the standard model said was impossible. He was a trained physician with clinical access to more vision data than almost anyone alive. He followed that data where it led and published what he found. He did not ask for permission from the optical industry before observing that their model was incomplete. He observed, he measured, he documented, he published. That is what physicians are supposed to do. The response was not scientific engagement. It was commercial defense dressed as scientific skepticism. His work was dismissed not because it was tested and found wanting, but because it was inconvenient to an industry that had not yet fully formed in 1920 and that would grow over the following century into $170 billion of annual revenue built precisely on the foundation that Bates's work challenged. 2.2 billion people on this planet currently wear corrective lenses. Most of them have been wearing progressively stronger prescriptions since childhood or early adulthood. Most of them have been told that deterioration is inevitable, correction is permanent, and there is nothing to do except update their prescription and buy new lenses when the old ones no longer work. None of them were told about palming. None of them were told about the 20-20-20 rule as anything more than a way to reduce screen fatigue. None of them were told that 90 minutes of outdoor activity per day has clinical evidence for slowing the progression of the condition for which they are spending hundreds of dollars per year on lenses. $170 billion in annual revenue depends on that information gap remaining exactly where it is. Your hands are already warm from reading this. Cup them over your eyes. Breathe. Let the darkness become complete. That is the exercise. That is the knowledge. It costs nothing. It always has. Subscribe and share this video. Every share reaches someone who will look at their next prescription renewal differently. Every subscription keeps this channel opening the vaults the optical industry thought were sealed forever. The next vault opens soon, and what is inside will change how you look at the dead battery in your garage right now, and the $2 solution that battery engineers documented in the 1930s that the replacement industry has spent 90 years ensuring you never find.